Injuries to the shoulder are pretty common. Sometimes those injuries are in younger people where the tendon is traumatically torn or removed from where it attaches to the proximal upper arm bone. Sometimes it's an attritional process, which with degeneration, that tendon may weaken and may tear from its insertion. So a rotator cuff tear is those tendons being torn from the proximal humerus where they would typically insert. There are also other problems in the shoulder which are fairly common and go along with that. Some people may have bursitis, some people may need bone spurs removed, some people may have pathology in the long head of their bicep tendon, which is the muscle on the front part of the upper arm and extends all the way into the shoulder joint, and there can be pathology there which needs addressed surgically as well. We are fortunate to be able to repair these structures now, typically arthroscopically. The large majority of patients, the tendon will be repaired back down to the bone just through small poke holes as opposed to a large open procedure. Through those poke holes, we're able to visualize it on a TV monitor or screen and able to watch what we're doing using the arthroscopic instruments. Usually we'll use several small anchors to repair the tendon back down to the bone. In patients with significant bicep pathology, sometimes we need another small incision just anterior to the axilla or the armpit region, where we'll reattach that bone through a small separate incision.